Well, welcome. I'm sitting with Dr. Jason Kaplan, cardiologist and physician. We're in Sydney, an amazing facility. Jason, thank you so much for taking the time out of your very busy schedule to come and sit with me today and have a chat.
It's an absolute pleasure, Sharon, and thank you very much for coming to speak to me. I'm really excited.
Appreciate your time. And my mother died at 73 with an aortic aneurysm, and cardiovascular disease is sort of in my family. And so, coming here today, I wanted to look at the preventative screening measures that we have, even for someone like myself that obviously has a good lifestyle and manages stress and does those sorts of things. I'm really interested more in these screening techniques and the test that we did today. Can you tell us more about that test?
Sure. So look, you're obviously a very healthy woman, Sharon. I've been up to Gwinganna, see what we talk about at Gwinganna. I've actually been there myself quite a few times. But looking at family history is really important. When someone comes into my clinic with a family history of heart disease, we really need to weight that fairly highly in terms of other cardiovascular risk factors. So if you have a family history of heart disease, it's really important to be able to get that checked out, checked out by your doctor or physician to see what's happening. The test we did today was a test called the SphygmoCor device, which is a test of arterial stiffness. Now, arterial stiffness is a major factor in hypertension, which is one of the most common diseases we see in Western society. And when you said your mother had an aortic aneurysm, one of the major risk factors for aortic aneurysm is systemic hypertension or high blood pressure. So for people who have a history of high blood pressure or aneurysm in the family, it's very important that they get their blood pressure under control. So before we start to develop high blood pressure, our arteries tend to get stiffer. That's one of the first changes that occur. So the device that we have these days, we're able to detect what's called pre-hypertension. So before your blood pressure starts to become elevated, we can detect whether your arteries are stiff.
Yeah.
So I'm very happy to say with you that your arteries are pristine. Your arteries are nice and relaxed and compliant. They're not very stiff at all. But you have the arterial age of someone at least 15 years younger than you, which is pretty amazing. So we can also gauge people's arterial age. The amazing thing about this device, which is a non-invasive device.
It's a pretty simple test.
It's a simple test, and it approximates what I would measure invasively when I do things like stick catheters and invasive tests on people, is that we get an idea where people are now, and also we can measure change with therapy. And especially when you have this condition called pre-hypertension, we can measure the effects of lifestyle and lifestyle change on high blood pressure, which is really important in people who either have borderline high blood pressure or even have early stage high blood pressure. Often lifestyle therapy is enough to make a big difference to them.
Yeah, it's cardiovascular disease obviously being one of the biggest killers in Australia and in most of the Western world. What do we need to know about this disease and how we can prevent it? And before you answer, one of the things I love about you, Jason, is that you are such a preventative cardiologist. You're really looking at how you can prevent people from, having this disease. So what can you tell us that we need to know in pre-screening, and how can we prevent this disease?
All right, well, it's so important these days to talk about preventative cardiology. And just to give you a preface for how I became passionate about this subject, when I was doing my fellowship at Royal Prince Alfred Hospital, we used to see people at the end of the spectrum. They'd basically fallen off the cliff already. They'd had their first heart attack, they'd had their first stroke, they'd already had a major clinical event that affected their life. Yes. I decided that it's much better to detect people very early before they have the event, and then we can institute change to affect so they don't have their first heart attack or stroke. So what we can do these days is non-invasively detect who is going to be at risk. Now, the majority of people who present with their first heart attack or stroke have no warning symptoms beforehand, because the really important thing is that the majority of cardiovascular disease can be silent until it presents for the first time. The majority of men, over half of men who present with their first heart attack in their 50s and 60s, have no warning that they had any sign of heart disease. But with some of the testing that we do, we're able to detect whether they'd be at risk and then institute either lifestyle measures and in some cases medication measures that can alter the natural history of their disease. And there are many things that we can do. I'm a very big proponent of a test called coronary artery calcium scoring. Now, the majority of heart attacks occur from cholesterol and fatty plaque buildup in people's arteries, and strokes as well for that matter, Sharon. Yeah. And what happens is that you get a bit of plaque and cholesterol plaque sitting in the lining of the wall of the artery, and for various reasons that plaque becomes irregular, and then a blood clot forms on that plaque, and then that blood clot occludes the artery. And heart muscle and brain muscle are very sensitive to lack of blood supply. So that's when you get a heart attack or stroke. So some of the testing that we do is we look for the presence of early plaque in people's arteries, and if they have it, we start to institute measures that to try and prevent the plaque or even reduce the plaque. It's very possible these days to show that you can actually reverse atherosclerosis or cholesterol plaque in people's arteries, which is amazing. We didn't think we can do that, but we know when you can start to cut out saturated fat, start to make dietary changes, you can reverse atherosclerotic plaque, which is really exciting.
So what's your number one prescription for that one? Because I think everybody will want to know that one.
To be able to reduce plaque.
Yes, absolutely.
I mean, it's not, I mean, lowering your cholesterol is important, but as I've sort of alluded to you before, and I think it's in the media, it's not all about the cholesterol story. What's really interesting is that over half of people who have heart attacks have normal cholesterol levels at presentation. So it's not just about cholesterol. There are other things going on in people's lifestyles, and especially in Australian modern society. And one of the major problems is the metabolic syndrome and sugar. People are overweight. They have inflammatory lifestyles. They eat foods. They eat a lot of white processed foods that are bad for them. They live very stressful lives. They have stress hormones going through their bodies. Yes. It's not just about the cholesterol levels. Yes, cholesterol, smoking, diabetes, high blood pressure are bad for arteries, but it's part of a much bigger picture why people present with heart disease. And I think one of the really interesting story is a town called Rosetta in Pennsylvania in America. I'll just briefly tell you about the story because this is a great way of demonstrating how it's not just about one thing. Really, you have to take people's whole picture into consideration. So this town in Rosetta is a town near Philadelphia in Pennsylvania. They have less than a third of the amount of heart disease than anywhere else in the state. Wow. Even towns 100 kilometers away, they have a third less heart disease. And why is that? So this little town called Rosetta started about 100 years ago, and it was a group of Italian immigrants came to the United States after very few of them came over, and they started building a community around this town. And eventually a whole lot of people came to live there from this one region in Italy, and they adopted very similar lifestyle mechanisms as they had in Italy. And as in Italy, they have a Mediterranean style diet, but also the really important things is they're very big on community. People are very involved. 3 generations often live in one house. There's less incidence of depression and anxiety. People look after each other. There's love and support within the community. And when people went and investigated why this town actually had a third less heart disease, people were dying of old age. They weren't dying of heart attacks and strokes like in towns 100 kilometers away. It was like an outlier, and it was Malcolm Gladwell talked about it in his book. And they looked at all these other factors that came into play. So it's not just about cholesterol is one thing. So when we look at someone's risk for heart disease or a major cardiovascular event such as stroke or heart attack, I tend to take the whole picture into account. We talk about in modern medicine and cardiology, Western medicine is very big at picking out what's the next magic medicine that's going to make a difference to people's cardiovascular health. And when I deal with a lot of pharmaceutical companies, and everyone's coming out with the next new drug that's going to make a difference. And the drugs will show incremental benefits. And each drug company will say to you, well, this drug has a 2% benefit over this drug. Yes. And in the big scheme of things, these are pretty small, to be honest. Yes. When you look at the major changes in people's cardiovascular health that we can affect, diet and lifestyle make the most major benefits in people's outcomes. There was a study published in the New England Journal of Medicine last year about the effects of a Mediterranean diet on cardiovascular mortality. So a Mediterranean diet, as you know, is a diet that's high in olive oil, high in whole grains, nuts, fruit and vegetables, less red meat, more chicken, more fish, more poultry, yes, unprocessed foods. Actually, in the study, people had up to 1 liter of olive oil a week, which is a decent amount, but they did. That's how I managed to get it in.
So that doesn't constitute a low-fat diet?
No, it doesn't necessarily constitute low fats, but it's good fats. Right?
Yes, right.
Yeah. And that coupled with regular physical exercise, I'm not talking you have to go out and run marathons, but you have to go and do at least moderate physical intensity 5 to 6 times a week for 30 minutes a day, and doing whatever you love. There's no one prescription for getting moving, yes, right? It's just getting your heart rate up and getting the body going. That managed to show a 40% risk reduction in major cardiovascular events. When you think about that, it's better than any drug that I can prescribe to people. Yes. And I mean, it's those sort of changes that make benefits in people's lives. Western medicine and our approach to cardiology, we're very good at patching people up. Our major strength in terms of cardiovascular disease has been to treat people with very acute problems. When people come in for heart attacks, we're fantastic at treating heart attacks, and we're fantastic at treating heart failure, and fantastic at treating very acute cardiology problems. Our greatest failure in terms of cardiology and medicine has been our inability to prevent people with risk factors having the events in the first place. Right. And this is where my passion is.
And it's where my passion is too. Hence we're sitting here. Yeah. Beautiful. So I think what I heard you say is that cholesterol, if you have even a slightly elevated cholesterol, if you don't have the actual cardiovascular disease, that's not so much of a problem. So sometimes people are acting on the cholesterol when they should probably look at whether they have the disease.
Absolutely. So when I see a lot of people with high cholesterol, and in the media or in primary care, there's a big push to treat people with all high cholesterol with cholesterol-lowering medications. Yeah. And a lot of people are on this drugs called statins, which I use a lot of for the appropriate people. And the way I like to think about it is we have to individualize the treatment for the person. Yes. Not everyone with high cholesterol will have the presence of atherosclerosis, and atherosclerosis is the fatty plaque buildup in the walls of the arteries that can cause blockages. So when people come with high cholesterol, I like to see, do they have the presence of this plaque in the arteries? Yes. And then you have a much stronger indication for them being treated. If they don't have it, there are other protective factors. Fortunately, the genetics, females are often better protected, especially premenopausal females are more protected due to hormonal reasons compared to males, maybe because they exercise, they have less inflammatory lifestyles, they maybe have more normal weight. So there are many other protective factors that will be reasons why people don't develop cholesterol plaque in their arteries. And what's really important, and this came out in this recent Catalyst program, is that if you're low risk of having a major stroke or heart attack, you do not stand to benefit from cholesterol-lowering medications. What I do on a day-to-day basis in the testing that I suggest to people is identifying who are the high-risk people and who they're the people that stand to benefit best from intervention. So that's what I do on a day-to-day basis. Yep.
So let's just step back to this diet of reducing the fat in the diet, but not reducing it too much, because often you'll have a nutritionist that says one thing and possibly someone like yourself that says something else. So, when we talk about healthy fats, we're talking about the monounsaturated, we're talking about the really healthy fats that come from nuts and seeds and oils and those sorts of things. I guess what we're trying to reduce is the hydrogenated fats or the trans fats, yes?
Yeah, look, trans fats is a killer. Yeah. It's the greater altered the fats are, and the greater hydrogenated or more hydrogen atoms, if that's why they're called hydrogenated fats, have been placed on them, the worse they are for our cardiovascular system. Yeah. These fats are highly inflammatory to our arteries. They promote atherosclerosis. Yeah. So, and we need a certain amount of good fats for our cell membranes. Yes. I mean, that's what's really important. Our bodies need a certain amount of fats to survive.
And hormonal balance.
hormonal balance, and they are building blocks for our hormones. They're building blocks for, estrogens, testosterone, cortisol, for all these things that we need a certain amount. And when we start to cut out the significant amount of fats in our diet, we start to impact that. So depending on where you fit on the spectrum, whether you have a lot of heart disease, whether you don't, you can vary the amount of fats that you have. But as this Mediterranean diet showed, people had a decent amount of fats, including a certain amount of saturated fats within their diet, and they're still managing to be healthy. So it's not about totally cutting out fats from our diet, and I think that's a really important message to get across. For a while, there's this whole thing about a low-fat diet, but low fat came with high carbohydrate and high sugar. And that's, in actual fact, has been, white sugar, white carbohydrate. It's been one of the biggest problems because it develops a metabolic syndrome. It promotes people to be overweight. And that's actually when people have diabetes, pre-diabetes, metabolic syndrome, that's even a bigger problem than high cholesterol in certain situations.
Absolutely. Let's just talk about depression for a moment, because I believe one of the risk factors for cardiovascular disease is depression. And, we certainly see a lot of people at the retreat who are on antidepressants. What are your thoughts on depression and cardiovascular disease?
Sharon, there's a very strong association between depression and cardiovascular disease. It's been shown in multiple studies, and the mechanisms are multiple. One of the reasons is depressed people tend to make poor health choices. And I think that's really important. They don't choose healthy foods. They don't choose to do a lot of physical exercise. They don't make choices in their life that support their overall health. And that's why people who are chronically depressed tend to do worse from a cardiovascular outcome. One of the people that I really admire, who's done a lot of research in this work, is Martin Seligman. The founder of positive psychology, and his latest book called Flourish, he talks about the power of optimism in heart disease. Now, the amazing thing is optimistic people live longer. When you adjust for any other cardiovascular risk factor, including smoking, high cholesterol, diabetes, high blood pressure, optimism stands alone and is just as powerful as any other risk factor in terms of longevity in cardiovascular disease. In fact, I have one of my questions, my patient questionnaires that fill in, do you feel optimistic about life? Because it's just a general gauge about how people are feeling, and allows me to, at least is a trigger to answer some of these questions. So there was a great study that showed that people who had their first heart attack, and then they managed to follow them for 10 to 15 years afterwards about their feelings about, did they have a reason to live? Were they optimistic? The Japanese call it ikagi, a purpose. And that's what's really interesting, why people in communities that involve older people, where people have an ongoing purpose as they get older, tend to live longer as well. And the optimistic people tend to live much longer than the non-optimistic people. The people that weren't optimistic about life, over half of them died in the follow-up period. So I think addressing that area is really important in people. When you have to look at their as I said, the cardiovascular disease is a very holistic pattern, and certainly depression and mood comes into them. In actual fact, I'm sure you see this at Gwinganna, that exercise is almost as effective as antidepressants in treating depression, right? Instead of putting these people on antidepressants, they need to get out there and exercise every day, right?
Yeah, absolutely. And one of my heroes, and I believe one of yours is as well, is Dr. Dean Ornish. What can we learn from his work?
So Dean Ornish was really one of the first and most well-known preventative cardiologists. He came up with the Dean Ornish diet, which is one of the first diet plans to show reversal of heart disease and atherosclerosis. And we talked about it's possible to reverse cholesterol plaque. Well, he's shown by being on the Ornish diet, you can actually do that. So Dean Ornish is a great leader in terms of preventative cardiology. So his 4 pillars include nutrition, fitness, stress management, and love and support.
Right.
And I think that's what you address at Gwinganna in terms of looking at people's overall health in that way. And without one of those pillars, the others start to, fall away. So I think Dean Ornish's message but his first message came from the fact that a more plant-based diet, more plant-based diets, less saturated fats from red meats and full-fat dairy, people were able to make a major difference to reversing heart disease.
Beautiful.
And I think that's really important for people who either do have heart disease or are interested in preventing heart disease, that adopting some of these dietary patterns can make a major difference.
So let's just skip back a little bit and go back to the carotid artery test. At what age do you think people should begin to investigate that carotid artery and where it's at, both males and females?
So the test, we look at two tests for atherosclerosis. The first, we look at the carotid artery, which is, as for people who know, it's the artery just in the front of the neck, the major blood supply to the brain. And also we look at the coronary arteries, which are your blood supplies to your heart. So for males, I would recommend males over the age of 45, it's worthwhile doing this test, and looks for the presence of cholesterol plaque. For females, generally, if you're fairly healthy, I would recommend over the age of 55 or postmenopausal. However, if you have established risk factors for heart disease, such as diabetes or blood pressure or a strong family history, I would recommend getting screened probably 5 to 10 years sooner than you otherwise would.
Or you're a smoker.
Smokers are the worst, Sharon. They develop vascular disease really early.
You need to give up smoking if you haven't already. And the test that I had done today, you can have it done at any age?
Have it at any age, right? At any age. And we see, we live in an urban population. I see lots of very younger people, say in their 30s, and with high blood pressure, and often get put on high blood pressure medications. And, it's crazy. When you're deciding to institute a medication that may be lifelong, and make sure that you've explored other options.
So let's talk about that. So somebody who, obviously I'm in good preventative care, but somebody who has just found out that they have some sort of cardiovascular disease or they have a risk factor and they're on blood pressure medication, and if they were to really shift and change their lifestyle, could they, over time, with support and also supervision from someone like yourself, get to the point where they back that medication down and even come off it?
I definitely think so. We're able to make major changes certainly in blood pressure with lifestyle intervention, and certainly reduce some of the medications that have people on. There are a certain percentage of people that will need to be on medication long term. And once again, when we talked about detecting cholesterol plaque, there's certain tests that we do on people's hearts that look for whether they are going to be affected by high blood pressure, or whether they need to run at lower blood pressures compared to other people. But I certainly think it's possible to come off certain blood pressure medication in a supervised way while you make dietary and lifestyle changes. Certainly cutting out the amount of sodium and processed food in our diets by losing weight to have a much more healthy weight, by having a diet high in fruit and vegetables and potassium-rich vegetables. Those are the ways we can make a big difference to people's blood pressure. And regular exercise. People underestimate the effect of physical exercise and weight loss on blood pressure, and it's very, very important. And the other really important thing is stress reduction. I know you're very big about stress reduction at Gwinganna. One of the sessions, the things I'm very passionate about is when you talk about stress management, is mindfulness meditation or some sort of more contemplative exercise or practice that's different to getting your heart rate up,
like yoga,
qigong, even a more moving sort of meditation, or even regular meditation. One of my heroes in that field is John Kabat-Zinn, and he has shown very eloquently at the University of Massachusetts that he's able to show 10 to 15 millimeter reduction in systolic blood pressure by regular use of mindfulness meditation. People regularly practice mindfulness meditation, and I think that's amazing. That's almost the effect of one drug.
It's so great to hear that, isn't it? And for a long time, meditation, you almost needed to whisper about it. It was some sort of hippie thing that was going on, and now we're seeing it in mainstream research that it's really proving to be a very powerful tool that we can use. So that's great to hear that.
You look at this week's Time magazine, it's on the Mindful Revolution. We're part of the Mindful Revolution.
We're there. Just finally, before we finish, I guess, someone who has had an event and they've had a heart attack and maybe they've had some stents put in and those sorts of things, and they might be sitting back thinking, well, it's all too late for me, and I've got my new heart now. I can just continue doing the bad things that I've always done. What would be your advice to those people?
Right. I mean, certainly you cannot neglect lifestyle. For people who've had an event, we like to have them on most of them will be on some preventative medications. Right. But the medications just play one part. For people who've had a stent, where you've had that stent, we've patched up that area with a stent, and you're not going to run into problems in that particular area again. But if you continue to neglect lifestyle and diet, you will run into a problem just downstream from that stent. Right? So while I think a really important message is, in Western medicine, we're really good at doing patch-up work. We can, do patch-up work, and we've got lots of technologies that will treat deficiencies or problems that people have in their lifestyle and diet. We're very good at fixing you up from the acute problem. Yes. But the reality is that lifestyle change is going to be the major thing that will impact most people's health, both from a physical point of view, but also from an emotional and mental point of view.
Yes,
as well.
Very much so. So it's all holistic.
Yep.
All holistic. Now, where are we? We're in an amazing facility here. Tell me about this.
So look, we're in a brand new facility that we have. It's called the Heart Care Centre. It's at Macquarie University Private Hospital. Yes. And we're right adjacent to the hospital. And it's Sydney's first private university teaching hospital and clinic. And we're part of a multidisciplinary cardiac clinic. So we have cardiologists from every subspecialty within cardiology, including cardiothoracic surgery, as well as facilities for full investigation and treatment of the whole spectrum of cardiovascular disease. So when people come in here, we're able to do a full preventative cardiovascular assessment, all usually within the same day. And if necessary, get advice from other cardiovascular specialists and physicians from other allied areas such as neurologists, vascular physicians about their cardiovascular care. So we're very excited to have this facility. And it's pretty brand new. It's only less than 3 months old. Well,
it's incredibly impressive. Thank you so much. Really, thank you so much. I'm so grateful, and I know everybody who will get the opportunity to see this will be really grateful for your insight and your wisdom and your knowledge. And it's so, enlightening for me, who've been on a wellness path for such a long time, to see that this integrative, this integration is happening between preventative healthcare and Western medicine. So it's such a joy to be with you. So thank you, Jason.
Thank you, Sharon.
Thank you. If you would like to spend more time with Dr. Jason Kaplan, he does run an event with his compatriot, which is Dr. Raymond Schwartz, who Raymond is a neurologist and he has a PhD in small strokes. They both collaborate together and they come to Gwinganna annually, and they run a specialty weekend called Brain Heart Health. So if you'd like to spend time with these amazing people and learn more about how to prevent cardiovascular disease and stroke, then give us a call and speak to the girls in the Retreat Advisor's office, and they'll tell you when the next one is on. Jason, thank you so much for joining us today. Really appreciate it.
Thank you so much for your time too, Sharon.
You're welcome. And thank you, everyone. Enjoy.